It is my pleasure to welcome everyone to the Finance and Physical Resources Committee meeting. It is Tuesday, December 3rd at 8:30 a.m. With that, we will open up with public comment. Is there any public that would like to address the Finance and Physical Resources Committee this morning? Seeing none, we will close public comment. That will bring me to the consent agenda. Is there a motion to approve the consent agenda?
So moved.
Support.
Anything have to be pulled? Okay, seeing none, all those in favor of passing the consent agenda, please say aye.
Aye.
Opposed, same sign. Motion passes. That brings us to item 3 from Fiscal Services. Wayman?
Yes, this is a request to the Board of Commissioners to appropriate an additional $177,500 in the 2019 Lodging Excise Tax Fund budget. The county levies a lodging tax in the amount of 5% on hotel motel facilities in Kent County as provided in PA 263 of 1974. Per the agreement with Experience Grand Rapids, the county will distribute 17.5% of 2019 lodging excise tax revenue to Experience Grand Rapids. If lodging excise tax revenue is greater than $10.2 million, the county will distribute 17.75% to the Experience Grand Rapids. For 2019, the county budget estimated lodging excise tax receipts of $11 million and appropriated $1.9 million for distribution to Experience Grand Rapids. At this time, 2019 lodging excise tax receipts are estimated to generate $12 million, with $2.1 million to be distributed to Experience Grand Rapids. Because of the increased lodging excise tax revenue, an additional appropriation of $177,500 is required for distribution to Experience Grand Rapids.
Is there a motion to approve?
So moved.
Moved and supported. Questions, comments, and discussions? Yes, Commissioner Morgan.
Well, thank you, Madam Chair. So we're in a contract with Experience Grand Rapids. What year are we in?
We're in the second to the last year of the contract. It goes into 2020. So we are expecting requests from them to renegotiate that by year's end, if not, soon, very soon.
Yes, Commissioner Bukowski.
Thank you, Chair. With this, is this kind of a not to exceed amount since they get paid a % based on actual receipts?
Yeah,
So, I mean, just to target 11 million a year ago sounds like a good number, but the precision as we get to the actual number?
Yeah, the numbers based on the contract, of course, we can't control what the
Right,
economy gives us,
correct.
but they are contracted at 17.75 for now.
Correct, but I mean, we're going to approve 177,500. However, it could be slightly less. What if it's slightly more? We have to come back in again? Because it's a % of revenue, correct?
Correct.
Right, but that's some certain we won't know until sometime in January when the year closes.
Let's have Marvin come up and,
Just making sure,
yeah,
like, how to giving you enough flexibility so we don't have to come back in for $50.
yeah, we
Marvin,
talked
come
about
on down.
Morning. So yes, it's an up to
That's
amount.
right.
So if it exceeds it, we'd have to come back again. We think it's a realistic estimate at this point, so cross your fingers.
All right.
You know, we did this earlier on in the year. I remember when we had one of these before. It was similar to this, where we came back and then we changed the action request later when we found out the number. So could you explain that process, Marvin?
Not sure, I don't recall, I guess, but if, one way we could do this is we could create a higher estimate, which might be a little more unrealistic, to cover ourselves so we wouldn't have to come back, or we could change the language to say it's 18% of tax revenue receipts and make it generic, because it is what it is. If it's whatever we collect in transient tax, we pay the 17.75%.
I simply want to be transparent with the board. So each time this came back up early on in the spring, we talked about making sure that you had the opportunity to review it and approve it. And so I'm good either way. We can
Yeah,
We
I
can
think
set it up either way.
Marvin makes a good point on the wording. It is what it is. We have to follow the contract. So if we have a generic line in here about being the percentage of the total receipts, and then you can put in a line that the current estimate receipts are, and that way it's open and we don't
Yeah.
have to worry about it, and we cover what you need to do
I just wanna
with
make
being
sure-
transparent.
I just want to make sure when this comes back through again, because that's what we were doing previously. The question came up and then we switched. I want to make sure that both sides, legislative and finance, are on the same page about doing what you're asking that we do. So let me do some back checking with a couple of the other members of the board before we move to make any changes.
Commissioner Voorhees.
Thank you, Chair Jones. The agreement that is held between Experience Grand Rapids and West Michigan Sports Commission, that is not a part of our contract. They negotiate that between themselves, is that?
Correct. Correct.
Commissioner Wooden.
Thank you, Madam Chair. Just writing on some of the previous conversations, if there's any recollection I have of some of the concern, it was over transparency, but since we'd have very little purview beyond fulfilling the contract, it might just be worth adding it to our quarterly fiscal reports showing where revenues are tracking and if they are tracking along the lines of what we're expecting. That might be a way of maintaining the transparency level without having to come back along the way. It is merely a thought, not even a suggestion,
Yeah.
but just a way to try to meet those two
Yeah.
needs.
Yeah, there was one board member, maybe two board members that questioned this, I think, back in the spring. We can modify the agreement to adjust it and do exactly what you said, report it out at a quarterly meeting. We can do all of that. But let me do back checking with those that had concerns to explain your wishes today before I move to bring it back.
Okay, anyone
good?
else? All right, all those in favor, please say aye.
Aye.
Opposed, same sign. The motion passes. That brings us to item number 4, also from Fiscal Services. Wayman?
Yes, this is a request to the board to appropriate up to $7 million to the 2019 Strategic Capital Project in the Capital Improvement Program Fund. The Strategic Capital CIP project was established in 2015 to set aside funding for future capital needs and to reduce the size of debt associated with larger capital projects. Any use of the strategic capital funding must be appropriated by the board for a specific project before it can be spent. For 2019, up to $7 million in funding is available due to an estimated $2 million in additional property tax revenue and up to $5 million in estimated general fund lapse. It's recommended that up to $7 million be appropriated to the 2019 Strategic Capital Project and the CIP fund from general fund transfers.
Is there a motion to approve? In support? Okay, moved and supported. Questions, comments, and discussion? We'll start with Commissioner Morgan.
Thank you, Madam Chair. So, this is primarily just a placeholder because we all know that we have these projects coming next year. I think there's 3 of them that we've talked about.
Correct.
So we're just placing it in here.
Correct.
So
And at some point later, this month, in fact, we'll be bringing back a request for the 3 specific projects that we're talking about.
I like it.
Okay, Commissioner Voorhees? No, you're good? Commissioner Wooden?
Thank you, Chair. So just to put a finer point on that, this transfer does not necessarily set any of those 3 projects in stone, and should we decide 1 or 2 of those 3, or 1 and 2 of those 3, and then money is spent towards another project, that could be done, or money could even be brought back from strategic to general fund without violating our financial policies, correct?
That's SB utilized, we've designated for strategic capital, go back to strategic capital fund.
Okay. So if money is left in strategic capital, it remains in strategic capital, it cannot be brought back for general fund purposes.
I'm recommending that it not be,
No.
simply because of the number of projects that we have.
Yeah. I'm not
At the end of the
recommending it
day,
either. I'm just
the
more
board-
asking procedurally.
Yeah,
Commissioner Bukowski?
Thank you, Chair. My question has to do with the additional $5 million in general fund lapse. So my assumption is we budget 6.5 million lapse because that's kind of been our experience, and I understand that. So this is an additional 5 million of lapse, so from a budget perspective, 11.5 million is lapsed?
First, good morning, Commissioners. The answer to the question is the items we're talking about lapse were for things that were not known at the time we adopted the budget. Let me give you a couple of big examples. One, the healthcare holiday that we have, probably $1.5 million for the general fund. That was not known until the financial statements came back in June of this year. So that was one of them. The other one was the Medicaid one. We finally got reimbursed for, I think it was 2011, 2012, for some funds that they changed the formula on, which meant they owed us some money from Medicaid. Well, but for us supporting that, we wouldn't have had to put so much money into the health fund, so when that came back, we pulled that back into the general fund. So that's also available for doing that. Right there is $3 million, $2 million additional tax, $5 million. There's a couple other small things that are there that weren't known at the time we did the budget.
All right, thank you.
You're welcome.
Yes, Commissioner Wooden.
Thank you, Madam Chair. And just to clarify again,
Just money.
the additional $2 million in additional property tax revenue, I also saw that in 2018, I think we appropriated $2 million to the strategic capital. Is that $2 million an expected additional property tax revenue that we have continually budgeted for, or is it just those 2 years we've had the same amount in additional revenue that we didn't budget for?
Okay, I'm trying to pick up on that. You got the revenue we didn't budget for. Yes, that's $2 million. It wasn't known at the time we adopted the budget. And then the other examples I gave you were things that weren't there. First of all, we planned on putting $1.5 million more into the health fund. Now we don't have to because of the Medicaid reimbursement. Those type of things that were extraordinary.
I guess what I was trying to say more is it merely a coincidence that we got $2 million more in additional revenue in 2 fiscal years, or is this a recurring additional property tax revenue that we have not budgeted for in several budgets?
That's correct.
Okay. And then in the past few years, how many times have we had additional general fund lapse beyond that $6.5 million that we budgeted for? How many times has that happened in the last handful of years?
Yeah, if you look at the history of strategic capital, the first time it happened was in 2015, and then we spent part of that, and then we had some additional in 2018 and 2019, okay? So that's just the 3 times that we kind of had extraordinary items that we could move.
Okay. All right, thank you.
Commissioner Morgan?
I'm all set.
You're good? Anyone else? Okay. Steve? Seeing no other comments or questions, all those in favor, please say aye.
Aye.
Opposed, same sign. The motion passes. That brings us to item number 5 from the Health Department. Wayman?
Yes, this is a request to the board to approve the Spectrum Health Systems contract for 2019 through 20, accept and appropriate $69,623 to the 2019-20 Health Fund budget for the Strong Beginnings Program, and authorize the board chair or designate to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. Strong Beginnings is a home visiting program that uses community health workers to work alongside nurses and social workers in the health department's maternal and infant health program to provide services that do not require the skill or expertise of a nurse or a social worker. Stronger Beginnings program's goals include improving birth outcomes and decreasing the rate of infant mortality, reducing the barriers of care for pregnant women, infants, and toddlers through community outreach, case management, and education, and engaging the community to advocate for culturally competent care. The Health Department provides services to high-risk women who live in Kent County, are pregnant, or the mother of a child 0 to 2 years of age. The agreement period for the Spectrum Health Systems contract is August 1, 2019 through March 31, 2020. In the event grant funding is eliminated or decreased, the positions funded by this grant will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations. Prior to signature, Corporate Counsel will review and approve all grant documents.
Is there a motion to approve?
So moved.
Moved and supported, and we'll take questions, comments, and discussions on this one. Yes, Commissioner Wooden.
Thank you, Chair. Just reading the letter that was attached in the packet from Spectrum Health, regarding that the award had been consecutively given since 2004, or at least Spectrum had been receiving it, and that there was essentially a lapse in the federal funding after 16 years. Do we know if that is essentially a blip on the radar, or if we're expecting that to
question.
happen again?
Good
And
question.
how we can do?
And have Adam London from the Health Department answer that for us, hopefully.
Good morning, Commissioners. Yes, that I expect is a blip on the radar. The funding was actually still in place. However, during the competitive process, there was an error made by a neighboring community that caused the award to be incorrectly given to a different applicant. As a result of the appeal process, that was straightened out, and so I expect that it will be consistent going forward.
Yes, Commissioner Bukowski.
Kind of related this and the next one, is this simply flat funding in the sense of the awards that we're getting? We're not increasing capacity or decreasing capacity?
That's correct. It's continuation funding of the program that we've had in place for a few years now. We expanded 2 or 3 years ago to include Hispanic mothers, but it's largely a continuation of that program we had in place for a few years now.
Yes, go ahead.
And then how are our infant mortality rates? What are they doing?
They continue to decline. And so I believe that Strong Beginnings has been a big part of the success that our community has seen over the past 15 or 20 years. The rate at one time, as you probably know, for black babies was near 20, which means that of every 1,000 black babies born in our community, 20 were not seeing their first birthday. That number over the course of the last 18 years or so has been cut in half. The number for Hispanic babies has also been cut dramatically, as it has for white babies. And we'd like to see all those 3 rates converge at or near 0 in the near future.
All right, thank you.
Yes, Commissioner Antor.
Thank you, Madam Chair. Morning, Adam. I was just wondering where it says high risk, provide service to high-risk women, what dictates high risk? What parameters, or what do we consider that?
Yeah, so income, first-time parents are the 2 biggest factors. Race is another risk factor here because of the data that we have that shows that there is a great disparity in infant mortality rates based on race.
And where do you get that information from? Does that come, how do you find out who just had a baby and all that kind of stuff?
Yeah, so we work with our providers,
Okay.
and we also work with community groups to refer young women to us. As you know, we have a variety of programs in our maternal and infant health programs. And so once we get these referrals, we can triage them to the programs they're eligible for.
Okay, great. Well, this is great. I know those numbers are fantastic, and really appreciate all the work.
Anyone else? All right, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. The motion passes. That brings us to item number 6, also from the Health Department. Wayman?
Yes, this is a request to the Commissioners to approve the Spectrum Health Systems contract for 2019-2020, accept and appropriate $264,600 to the 2019-20 Health Fund budget for the Strong Beginnings Pay for Success program, and authorize the board chair or designee to execute the grant agreement, approve extensions and amendments and increases to the grant appropriations not to exceed 15% of the original award. Strong Beginnings, again, is a home visiting program that uses community health workers alongside nurses and social workers in the maternal health, infant health program, and they provide services that do not require the skill or expertise of a nurse or social worker. The Strong Beginning program goals include improving the birth outcomes and decreasing the rate of infant mortality, reducing the barriers to care for pregnant women, infants, and toddlers throughout the community, outreach, case management, and education, and engaging community to advocate for culturally competent care. The Health Department provides services to high-risk women who live in Kent County, are pregnant or mothers of a child 0 to 2 years of age. The agreement period of this contract is January 1 through 2020, August 31, 2020. In the event grant funding is eliminated or decreased, the positions funded by this grant will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations. Prior to signature, council will review and approve all grant documents.
Is there a motion to approve?
Support.
Okay, moved by Commissioner Sparks, supported by Commissioner Breve. Questions, comments, and discussion? Okay, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. The motion passes. That brings us to item number 7 on the agenda from Human Resources. Wayman?
Yes, this is a request of the board to approve the MPP pay range and benefit changes effective January 2021. Approximately 269 county clerical, professional, and management positions are covered under the management pay plan pay structure. As authorized by the Board of Commissioners, the management pay plan administrative process provides for periodic review and adjustment of the pay structure for MPP positions. Human Resources recommends that the MPP pay structure increase by 2.5% to maintain alignment with the market. MPP employees who meet performance expectations will receive a 2.5% wage increase plus any applicable step increase. An additional $388,124 will be allocated as a one-time adjustment to address employee advancement through the pay steps based on years and position. The wage increases are effective with the applicable pay period that includes January 1, 2020. Basic life insurance and accidental life and dismemberment coverage will be changed to a flat amount of $50,000 each. No MP employee coverage will be reduced. This item was recommended for approval by the Legislative and Human Resources Committee at its October 22, 2019 meeting, and they approved this.
Is there a motion to approve?
So moved. Support.
Okay, moved and supported. Questions, comments, and discussions, and we'll start with Commissioner Voorhees.
Thank you, Chair Jones. So is this normally, Amy, a 5-year contract? I realize is that?
This is
There's no contract.
No
Come on up, Amy.
What I just read?
Because
What I just,
it-
grant total for 5-year contract.
No,
A plan.
this is an annual decision that's made by the board, so we're only asking for funding for next year.
This is just for the MPP, not the union employees, where we do have contracts that bind us to those.
I just, at first I'd seen where it said, this is the total for the 5-year contract.
That's probably just a clerical error on our part.
Oh.
I apologize for that.
Sorry. Thank you, ma'am.
Commissioner Bukowski?
Thank you, Chair. Since Commissioner Morgan, noted history earlier in the agenda, I think it would be good to note for this item as it goes forward is that we as a commission, a few of us, I being one of those few, reviewed the MPP a couple of years ago with great detail and recommended that we do these kinds of things so as to be fair with the folks that pay is decided by this. So just that a little bit more ink to say the commission scrutinized this, and this is according to those recommendations that we made to staff to make sure things are fair to folks that are not represented by a union. So again, we get some of the blame/credit as well. Thank you.
Yeah, Commissioner Vandermolen, I think, was the chair of that committee.
He was.
Commissioner Morgan?
Commissioner Bolkowski is correct. So, this was the MPP. Does this help with the compression issues that we were running into a few years ago?
Yes, it does.
And this is a one-time adjustment to that. And so, yeah, I'm all good with it. Thanks.
Commissioner Antor?
Thank you, Madam Chair. In spite of all the scrutiny, I might have forgot this part, but I was wondering about the steps themselves. How many steps are there in this? And does that number change at all as we renegotiate contracts and so forth? Or is that usually?
With the MPP, the the commission approves the pay structure, so we don't have any contract negotiations for this particular group where we're seeking approval. And there are 5 steps to get to the market rate for the MPP.
Okay, and does that 5-step, is that pretty consistent with all the other contracts we have?
Nope, there is some variations. There are some where there are 6 steps, some where there are 2. It just, there are some variations that are based on the history of bargaining and the nature of the job and
Whatever.
how people get to the job.
Okay. All right, that sounds, thank you.
Okay, anyone else? Yes, Commissioner Sparks.
Thank you, Madam Chair. I'm happy to see that we are making adjustments. Cost of living has gone up, and it's hard to retain good employees. We see that. We've got great employees in Kent County. So I have a question about the $50,000 for the life insurance and accidental death, that life and dismemberment. What was that before? It says it was changed to an amount of $50,000. What was that before?
It was one times income with a maximum of $50,000, so a handful of MPP were below that. And this really is something that helps the employees because it brings them up to the $50,000 if they weren't there. And it makes it much, much easier for us to administer with a consistent life insurance amount.
Good. I just wanted to make sure we didn't go below. Okay, good. Thank you.
Hey, anyone else? Thank you, Amy. Seeing none, all those in favor, please say aye. Aye. Opposed, same sign. The motion passes. That brings us to item number 8, which is miscellaneous. Is there any Commissioner miscellaneous this morning? Okay, seeing none, we are adjourned. Our next meeting date is December 17th.